First of all, thank you all very much for being here on a workshop regarding twinnings from IN-4-AHA, the first webinar of the year 2022. My name is Diogo Videira. I'm working with Porto for Aging. So as a brief summary, very, very brief. So we'll have two presentations for starting. Professor Lionis from University of Crete. And then we'll have a second presentation from Pablo Delgado from Junta Andalusia. Then following that, we'll have a very brief presentation about the 7 twinnings already selected. And following that, we'll have some explanation on the procedure of applications. So without further ado, I will pass on the floor to Professor Lionis, and he can start the presentation as an adopter within the twinning processes.
Okay. Oh, thank you very much. And I'm just trying a little bit to enlarge. Okay. Is that okay? Can you hear my presentation? Hello?
Yeah, we can hear you very well.
Okay, thank you very much. First of all, my apologies for giving quite shortly our wonderful experience we got from this twinning, and I'm very grateful for all of your support and facilitating this presentation. I think that I'm in the next 5 minutes. I'm planning in giving the experience we're having from this twinning with Andalusia. That's we say an exercise, but it's a fantastic experience. And as usually, we started from acknowledgements and the warm thanks to many people that we provided support and facilitated this twinning and this transfer of exercise. You can see all of the important persons, especially from Andalusia public health system. That's many people they coming across to the list. And of course, I'm adding Professor Hariklia Jiraki and Dr. John Farrell. We just facilitated this transfer of experience. And certainly, I'm expressing pleasure to the European project managers, but in generally, the Andalusian public health system, the European Innovation Partnership on Active and Healthy Aging, and certainly now at the moment, that's the center in Porto and which the facility they supporting this workshop. I think that the main aim of this short outline is just presenting what exactly we agreed, giving the objectives, the concrete plan, and exploring the new opportunities and outcomes, but also the vision of this twinning. It's presenting what exactly initially planned, but what at the moment, despite the strong and hard condition due to the pandemic, what exactly we achieved, and then also what now we're planning to implement in next this current year. In this slide, we just giving the overall aim, and the subject of this training was the transferring experience in regards to the palliative care. And the most important is just giving emphasis on communication skills, including compassion and motivation interviewing. And we decided to address this exercise in address the undergraduate medical students, general practitioners in vocational training, and also, of course, citizens and stakeholders. We decided in transferring the existing experience in Andalusian public health system and saying how to adapt it and well tailoring with the Greek conditions and Cretan condition, which in generally palliative care is a lacking subject, even in undergraduate medical training, but also in the vocational training for general practitioners. Still, the Greek system, the Greek national health system, has an empty room in regards to palliative care. I think that is one of the first that we explored, and we decided the 4 steps. The first step is just to translate it and validate it existing material and to see how they could be adapted in the Greek conditions. And second is just to exactly see what is relevant, if it is those documents and the subject relevant to the needs of all the target groups, means medical students, GPs in vocational trainings, stakeholders, and citizens. And exploring opportunities to transfer, to develop e-learning opportunities or digital solutions, synthesize the knowledge, and exploring further opportunities in strengthening the relationship between the originator and adapter. We of course we discussed initially methodologies that we could use, especially in the second step. One we seeking the relevance on behalf of the target groups, and we decided to implement qualitative and quantitative methodologies and forming focus groups despite all the difficulties in this COVID-19. And just quite rapidly, I'm passing the steps. The first step was thus to translate and adapt the material. You can find in the left the first document, which just was almost a synthesis of existing guidelines and guidance given to the people in regard to the provision of palliative care. And the second document was just a planning, especially addressing the stakeholders, how to prepare a management plan to implement palliative care. That's both the documents has been produced by the palliative group working and serving the Andalusian public healthcare system. The second step was just to explore opportunities to see the relevance and checking the acceptance and the feasibility. On the right, you can see the initial assumptions, or have already put in some numbers in regards to the medical students, the GP trainings, and the citizens. And then on the left,
I'm really sorry to interrupt you, but the slides are not passing on the shared screen. Could you try and check that?
What is it?
The slides, the presentation that you're referring to? We are only on the first page of the presentation. Could you check the presentation, or maybe
sorry,
sharing?
I'm checking. I'm seeing.
Could you maybe stop sharing and then trying again?
Yes.
Thank you.
I put in again, and
yes, thank you.
Is better?
No, it's good. Thank you.
Yes, but not moving. Is that now you can see the flow of slides?
Yes, we can.
Okay, that is the knowledge. That is the outline. That was the main overall aim and objectives. That was the 5 steps already I shortly presented. That was the methodology already we have discussed. And that was the documents we have already decided to translate, and the material has been translated. And that was about the initial assumptions and what we have achieved. And at the moment that we're exploring, based on methodology, the relevance and acceptance by medical students, and the medical students already have been agreed, and that was a wonderful outcome, is that already one day seminar has been included in the undergraduate medical training, especially in the course when providing opportunities to our medical students at the 6th year in visiting primary care. We explore the relevance and acceptability by general practitioners, and at the moment the general practitioners in training exploring opportunity to see an adaptation of the guidance, but in terms of the citizens, is needed to is remaining to be tested. In terms of the digital solution, and to see the feasibility of the acceptability by the stakeholders, that is a very important issue. Already the documents have been delivered to stakeholders in the regional health care services, and there is quite an acceptance to go on development of an important palliative care unit in the Heraklion, and that is a challenge for us, since it is one of the most important outcomes, activating and motivating the people to see palliative care as an important step. And certainly that we have discussed the opportunity to develop a learning program that means digital solutions in spreading more the guidance. That is the last step, which just there are still many issues to be implemented, but the most important there are several ideas to put it on the priority. And the first, we have discussed and taking the opportunity to developing a common workshops with Andalusian colleagues. The second is to exploring the opportunity, all this experience to be transformed and offering and developing and learning procedures. But the most important is just to see how, to what extent this already the decision has been made by stakeholders in providing the Department of Palliative Care in the urban primary care center in Heraklion to be implemented. I think that I'm providing a couple of achievements, but also there are many other issues to be implemented. For us, that is the summary. That was an inoculation, that's an injection of a concept that has been transferred to the target population. I think that is the most important, and I'm hoping that after the end of this pandemic, Omicron variant, have an opportunity to communicate with Originator, with a strong Andalusian team, and implementing that approach. Thank you very much.
Thank you very much, Professor Lionis, for your great presentation. If anyone has a question, right now would be the time to do it. Okay, so if not, thank you so much, Mr.
Thank you very much. Very much appreciate. Thank you.
Great to meet you. Thank you. Okay, so moving on, we'll have Pablo Delgado. Pablo is a coordinator of external action, EU programs and evaluation at Junta Andalusia, and he has participated in a twinning where Andalusia shared their Telecare platform with the partners from Kraljevo. Sorry if I misspelled this. So, Mr. Pablo, I understand that you are here with us now. Thank you very much, Mr. Pablo Delgado. So I would pass you on the floor. Thank you so much for being here with us.
Okay. So I'm just going to give you a short presentation on the experience we have with Kraljevo. This is a region from Serbia, and they were really interested to see the Telecare service that we have implemented in the region of Andalusia, which is also part of the IOP in AHA. We got 4 stars reference site together with the health services. And well, we were contacted and they wanted to see what our service is. So I'm just going to give you a presentation of our service, which was really what we showed them, and a bit of feedback on the experience of Originator. So I will just share the screen. I hope it works. Can you see something?
Yes, we can see.
Okay. So This Andalusian Telecare service is part of the regional Ministry for Social Policies and Equality and Conciliation in Andalusia. This service has been going on already for more than 20 years, started off as a pilot in 2000. Nowadays, we account for more than 235,000 users in the region. The main reason for the call is to provide a service that is helping elderly people, people with disability, and people in a dependent situation. So mainly it's a support service for those who are in a vulnerable situation and maybe loneliness and need for social interaction. And also we have a system in which we handle emergency calls. The system with a pendant and a push alarm button in the devices at home. So if something happens, they push it, and then we get in touch with the health services and send the necessary resources. We're quite a large service indeed. So we have a lot of calls at the moment, and it's increasing every year. So in a day, we have more than 17,000 calls. Many of them mostly are outgoing because we provide a lot of follow-ups, and maybe a third of it is just incoming calls from people pressing the push alarm buttons. Apart from these buttons, we have additional social services like information services, services for gender violence at home, for the elderly. So there are additional services which are also handled in the same call centers, but they are different services. We cover the whole region of Andalusia. So we have two centers, one is in Seville and the other one in Malaga. And between the two call centers, we sort of have a division in geographically in the way that we handle the calls. But if any of those centers has any problem, we have a backup system in which the other centers get all the calls from the ones who is not working. We are more than 600 people working in the service, and we have 243 call posts between the two call centers. So I think main input for them, it was to see our service, because we don't only have a response service in case of emergency, it's more of a proactive calling service. So we really have a follow-up and try to get contact with all of our users at least once a month to see how they are going. And if any event, unforeseen event, like there is an incident, some family member pass away, they have a medical situation, we provide follow-ups to make sure that they are feeling all right. So in general, what we try on the main objective of the service is to provide support so these elderly and people with disability and dependent people can stay at home for longer, feeling safe and well. So if you look at the nature of the calls that we have, most of the incoming calls are, this is an interesting fact. We don't have, we have a huge number of calls, but the truth is that most of those calls are from people who are feeling isolated and they have this need for social interaction. If you see these percentages, most of them are pressing the button because they need to talk. So it's more like an emotional support service. And of course, this is 32%. We have technical assistance in which we have some problems that we need to solve, either because it's not working or they need some technical issue that needs to be taken care of. And then the other 24% are health and emergencies, which is indeed where when they press the button and then we have to mobilize resources to solve the situation. And the other 19% are actually calls from users who are just want to find out how to do something that they don't know how to do. Either we derive them to the appropriate service, or we try to guide them into the process so they can figure out how to do something. And the outgoing calls are mostly follow-ups in which we make sure that the users are all right, and this is mostly where we take all of the resources. And then the 7% is also to make sure that if, for example, we get in touch with the health emergency services, we are the ones who get in touch with them. We make sure that the ambulance is sent. We make sure that which hospital has been sent to. If they have been discharged from the hospital, which is the hospital they have been discharged from. So we inform family members or carers or informal carers just to make sure that everything is sort of we close the loop in terms of information. And then again, many other issues that sometimes are unforeseen, and of course we take care of them as well. So those mostly give you a perspective of the nature of the calls. So in this, we provide and try to do our best to do a personalized service, which is attending the specific needs of the user. So when we call a user, it's not only that we do a regular follow-up, but we get the details of their situation. We get information about how they feel, information about the medication that they take, reminders, GP appointments. There's really a lot of things, and really depends on the user. Some of the users don't even want to be called unless it's necessary. Some of the users really need someone to be taken care of. So then we provide a monitoring system based on these events that we recorded, so we can actually provide a personalized service attending to the nature of the user themselves. So we have this database, and we fill this with incidents, and based on this, you know, the evolution, how the users are going, we provide more or less follow-ups on the cases. There are two things that we did through European projects in the past. One was that connecting the health emergency service with our service. Before we have to, it was a bit complicated. We have to call the emergency services for them to call the user, and then we have to get the user as well to give us the feedback. It was a triangular thing that it was not working well. So what we did is we provide a system in which we transfer the voice and the data straight away from the user to the emergency services. So they have on the screen everything related to the user, medical history, events, address, family contacts, and also the call in the call itself. So based on this, they can put action in a faster and more efficient way. And then many of those calls, we have a triage set of questions. So we actually take a lot of workload from the emergency services, because many of those situations don't really require an emergency ambulance or something like this. Maybe they just require for the user to go to the medical center and see a GP. So it's actually a way to distribute and get a lot of workload off the emergency services. And the other thing was similar, but it was to do with medical advice. Sometimes they call and say, can I take this medicine? Is this good? Is it not good? So with this kind of user, we provide the same service, and we derive the call and the transfer of data to the medical advice system. And especially now after the COVID situation, what we did as well is to provide some platform in which we are able to coordinate and appoint and get GP appointments for the user without the need for the user to go through the medical services, because we have a huge number of calls, and this is also in a way freeing the medical advice services for many other issues other than taking the GP appointments. So as you see, it's really a proactive service. Maybe this is what is different from other telecare services in Europe. We have annual user satisfaction survey. They were really happy, and every year we have quite a high score. And you can see that many of those things for the users, when we request what they would like to have on top of what they already have, is they want, some of them really want to be called even more often because of the social isolation. Home assistant, telehealth, mobile telecare, support with administrative hub, home visits. There are a lot of things that obviously we cannot take care of all of them, but with the help of new technologies, we try to get and improve the service every year. So when we explained this to Kraljevo, they were quite surprised. For us, it was a good experience as Originator, because we got a lot of feedback on our service. Especially, they were surprised on the scale and the approach that we have, this proactive approach. it was good to see from our side another perspective with other EU services, the diversity that they have, because obviously every telecare service in Europe is different, the way they provide the service and the catalog of service and so on, and also the size, because many of those services are local or private, and we are a public agency who covers with public money the whole region of Andalusia. So we also get new improvement idea when we talk about what we do. We exchange conversation and idea with them. So a lot of things about how we process the data, new devices, the platforms that they are testing and we are also testing, mobile telecare, how we make the platforms interoperable between each other, training and roles, and how we integrate the health services. So in general, it was really good experience. We were quite happy to have this experience as twinning speaking with them. It was really good communication. We share different ideas and approaches. We even see the further potential for our service to be developed, and we were open for future work collaborations. Indeed, thanks to this twinning, we are now working on a proposal for Horizon Europe with AI applied to the detection of cognitive impairment disease, and in which the partners that we have from Kraljevo are also involved. So this was an open door for us, and this is the outcome. So in general, it was a really good experience, and we were quite happy to be part of it. So that's all. Thanks.
Thank you very much, Mr. Pablo Delgado. It was great that you had such a good experience and that you are now following up with new projects, also involving the adopter that you had on that program. If anyone has a question, now would be the time to do it. You can also write them on the chat box. Okay, Ms. Jacqueline.
Hi, thanks very much. And thanks, Pablo, for a really excellent presentation. I was very interested in the number of people that were contacting you in terms of conversation. I think you had 32% in one of your earlier slides. And then in your user satisfaction survey, that was borne out, the loneliness and isolation element was borne out in the number of follow-up calls. People were asking for more. So my question is, are there any attempts to maybe try and develop a strategy to tackle the loneliness and isolation, given that that's something that's obviously coming up as a recurring theme? And is that feeding into any wider healthcare strategy or government strategy in terms of loneliness and isolation?
Yes, this is a good question indeed. And this is one of the main issues that we are facing at the moment. And I think it got even worse with the COVID situation, because some people are already isolated because they live alone, but because of this pandemic, there are even more people with this need for social interaction. So, I mean, we try different things because a lot of people are installing apps in the user. Well, some of them are able to use the mobile phone. Through the app, they get interaction as well sometimes. But even in previous projects, we have even tried to put healthy lifestyle for them to interact and do activities and programs like this. But our feeling in the end is that all the things actually work, but it's an interesting fact that what they look for is someone on the other side of the phone line, some human interaction. They don't want a machine, they don't want an app, they don't want someone, they want some human to listen to them. This is psychological need, but it's a fact. I mean, and for us, we are getting overworked sometimes because of all those need for people. Sometimes we cannot even manage to do the once a month follow-up call for all of the users. So imagine if some of them are feeling really bad. So in a way, I mean, they always have the chance to push the land button and someone will answer. This is for sure. But in terms of follow-up, sometimes we cannot provide as much as we want. But the chance for them to push the button and someone will be there is good. But we also have to make sure that we follow handling the call in a nice and emotional way, but being aware that also we cannot be there for 1 hour talking to them.
Yeah. It's no, I mean, it's a huge challenge.
So I think it's a matter of training the staff to balance.
Yeah. No,
it's a difficult one.
It's really interesting because, like, I mean, a lot of countries are the same, and we're looking at that, significant challenge as well at the minute, but it's just really interesting to see that evidence base. Thank you very much.
Yeah, you're welcome.
Thank you very much. We have another question from Ms. Diane Whitehouse. Can you see it in the chat? If not, I can read it, Mr. Pablo.
Yes, I can see more. Okay. Yes, basically, I think it was 2 days. I have to remember this by heart because it was in 2016, so it was already 5 years ago. But it was for 2 days, in which they visited different things. First of all, we showed them the installation of the Telecare service, the call center, the software, the different way in which the calls are handled, training materials, technological meetings with the people who are developing new platforms and testing devices. And then I think the next meeting was more to do with how we organize the service in terms of resources and the scope of the service, and then the way in which is a structure, like a department for R&D, department for sometimes we have this recording of calls for quality purposes. So we have these people listening to the calls, making sure that they follow the correct protocols, something like this. So there were different issues that were showing, and how the service is implemented, how the service is managed, and how the service is actually both from the user side and from the professional working on the other side. We did a presentation which is pretty much the same one in terms of content that I gave you, although the ones I gave you now is updated in terms of numbers. It was very practical as well, because we have them on site looking at the actual call post, looking at how people are handling the calls, looking at the software. We have different software. We are running with Tunstall software, which are a really well-known provider for Telecare service. And then based on this, we also have a lot of different other software and devices, not only Tunstall. So from Serbia, it was a mix of people. There were people from technical SMEs working in the provision of the funny, interesting thing is that Serbia didn't have a Telecare service as such. What they have is a support service for elderly people based on people who are working on a voluntary basis, or people with gerontological centers where they have these people, elderly people at home, or living in residences, or spending time in places where they have all these kind of devices. It was very different from the way that we work. So that was really enriching as well. And then we also have, I remember technological partners, the city of, yes, it was the health services from, I have to remember now the name. I cannot remember the name by heart because they were a composed, like a small consortia of Serbian representatives. But it was them, and it was also people from the medical service, looking at how these devices are working with the user. But it was very different from the way we did. It was really, really well. And as you mentioned, I think the best feedback that we have at the moment, it was the fact that we are now working on a joint proposal for Horizon Europe, which is really good.
Thank you very much, Mr. Pablo. It's great to hear that. So if anyone has any other question, would be the time to do it. If not, we'll now move on to the presentation, presenting the 7 twinnings that were chosen on this first selection program, and then how to apply for the next 3 vacant spots. Okay, so let's move on then to the presentation. Again, thank you very much, Mr. Pablo. Thank you very much, Professor Lionis. It was great to hear from both of you, and hopefully it will inspire others to continue. Mr. Pablo, if you're still here, it seems that there is another question.
Okay.
At the moment. The question is on the chat box. Sorry if I missed it, but can you tell us if in the context of the Twinnings, is it your platform that operates in the adopter's country, or did they set up their own platform in the adopter's country?
They have their own platform. We didn't have to go there or help them to implement something. I think it was a matter of transfer of knowledge on the way we work, how we do it, how we organize ourselves, how we train the people, what kind of different service we have among the overall service, and things like this. But the platform is totally different, and they have their own, which is also enriching in a way, because now that we are proposing this joint proposal is a good collaboration, because they do things that we don't. Actually, they are very advanced in the sensors and devices, because they don't have such a proactive service. So the way in which they compensate this follow-up calls is through the data collection of users through sensors, which is part of what we want to do now. So it's a good combination.
Great to hear. So let's now follow then to my presentation about the Twinnings that were selected. And thank you all very much for your presentations and for the questions. It's really important to discuss this. Okay, so just a moment, please. So I will apologize in advance if you hear too much barking from outside of me. Just a moment, just share this. Okay. Okay. Okay, sorry. Okay, so can you see, is it all good? Okay, thank you. So moving on. So on the first call for Twinnings, we had 7 Twinnings that have been approved. So 7 innovative practices that are going to be shared between institutions. So we have 4 originator countries and 4 adopters. The originator countries are Spain, Portugal, Northern Ireland, and the Netherlands. And the adopters are from Greece, Italy, Spain, the Czech Republic, and Portugal. So the innovative practices, they range from digital health records to apps to manage cognitive decline and to co-creation platforms, among others. So moving on to the specific Twinnings, so without any specific order. So we have first the Ministry of Health and Families of Andalusia, the reference site, which will be sharing Click Saúde Plus, which is a portal for citizens to access personal health information for both administrative and clinical purposes with the Scottish Government reference site. More specifically, this will be used within Scotland's digital front door program for promoting inter-regional partnerships. Both of these centers, they are both 4 stars with excellence, and we believe that this exchange will be very useful for both sides. Following that, we have Lisbon Active and Healthy Aging with the Galician Health Ministry reference site. So they will be sharing a tool for developing physical and cognitive exercises, which is ready to implement in elderly populations. This will be done by the company Active Age with an interactive digital platform for what I've mentioned. And then it will be adopted by Galicia's healthcare in the context of Attendo. In this case, Attendo is a Spanish company that provides community, home-based, and ICT skills for the elderly people, and it will implement aspects of active age and that will allow the platform to be tested, translated into a new setting, leading to possible new iterations, improvements and innovations also in the originator, increasing the efficiency in general for their activities and improving the experience of their clients, of their possible clients. Then on the third one that we have here, we have digital health and care from Northern Ireland, from the Department of Health of Northern Ireland, which has developed a series of innovations, mainly in the digital service offering support for people living with dementia and their carers. This is the apps for dementia library, sorry, which is in the following page. Okay, so also on this page, sorry for my mistake, we have Attendo receiving, also being the adopter of another program. In this case is My Home Fits, from that organization specialized in delivering smart tools to support age-friendly environments, citizen empowerment, health self-management, and aging at home. So the idea is for this smart library to enable older people and their professional or informal carers to get neutral information, as well as to lend smart technologies for a few weeks to experience their use and value in their regular daily lives. After a few weeks, they will return the technology and can decide for themselves if they want to purchase it or not. So this is specifically a technology exchange between these two sides in order to test them, to see if they would fit into this environment, and to have knowledge sharing directly between these institutions and the possible future partnership also between them. Okay, so following up to the one that I was explaining previously, sorry for the mistake. So again, so this one is between the Northern Ireland and the Campania reference site. They will be sharing the apps for Dementia Library, which is a phone hub that will pass on various information and about various information about the profile of the clients, and it will be shared then with the Naples reference site in Campania. Okay, so following up on to the next one, so our fifth one, we have the same originator, in this case Digital Health and Care from Northern Ireland reference site, and it will be sharing also apps for Dementia Library with two specific apps to support dementia patients and their careers. And then this will be shared with a Greek NGO, which is Epioni, and they will be receiving then this information and also using this library to their to the people that they take care of. This again regarding dementia, and it will improve the quality of life for both the people with dementia and those who love and support them. So the idea is that this twinning is aimed to enable patients and caregivers to have a more active and healthy life through the implementation of an ICT-based solution. Also, this twinning activity will enable the upskill of best practices, will strengthen the relationship between the different reference sites, and may lead to future joint ventures and collaborations. So then the sixth one that we have, it will be between also between the northern Spain region, represented again by Galician Health Ministry, in this case Axis. Which will be sharing is innovative practice Galicia network of health living labs, so Lab Saúde, with a Portuguese NGO, Santa Casa da Misericórdia of Ribadave, represented by Porto for Aging. And so Lab Saúde has an approach of for the care of the elderly and chronic patients, introducing new technologies and tested in real-life contexts through a living lab So translating this initiative, they will be sharing the idea and sharing their concept with to the Portuguese regional ecosystem, ideally to empower patients, families, caretakers, and share the practice that they do with Ribadav, which works mainly with dementia patients in order to share how it works and to also promote the possibility of future cooperation between the two sides through user-centered practices. Lastly, we have the Ministry of Health of Catalonia with the Foundation TIC Salut via the reference site with Rovira within the Virgili University. The Virgili University was crucial to the development of Socatel co-creation platform, and it's a tool that will for long care services designed by a multi-stakeholder coalition based on quadruple helix approach, including the input from professionals, users, researchers, and innovators. So Socatel will be adapted to the digital health platform of USTI region reference site through the Innovation Center of USTI region. Okay, so the 7 current twinnings are presented. So we have 3 slots remaining, and the second call of twinnings will be open until the 4th of February. So this would be the opportunity for all those who are interested to then apply to the new program. So then, if anyone has any questions regarding this these twinnings, you can ask them now. If not, I'm going to move on and present how to apply for the follow-up twinning. Okay, so the criteria, the most important criteria to apply as a reference site is to be to apply for a twinning is to be a part of a reference site. In order to know if you are or not a reference site, it's best to check the list, but you can always contact us, and we should be able to inform if you are or not part of a reference site, or if you have a reference site in your country. Then the most important part is really to either have an innovative practice that you want to share, or that you know of an innovative practice that you'd like to adopt. The priority would be given to pairs from Eastern and Northern Europe, as there are not many that have applied yet. However, this is not exclusionary, so parties from anywhere other than Eastern and Northern Europe would also be very welcome to the program. Then also, there's also priority for innovative practices that are capable of improving and monitoring health and care systems performance, increasing availability of practical solutions, co-creation with end users and stakeholders, as well as ecosystems, wide business models, improving the capability to plan and carry out efficient investments in health and care at the national and regional levels, evidence-based strategies and policies on transforming health and care systems, increasing leadership of European researchers in the relevant fields by increasing digital and health literacy among citizens and health and care practitioners, and lastly, increasing capacity building efforts to facilitate the use of a common language among relevant stakeholders. So again, anyone can apply, as long as you're either as an adopter or as an originator of a technology. And although there are a priority criteria, and we would very much like to have companies from either Eastern Europe or Northern Europe applying to make the transfer, again, everyone is welcome also to participate within this network. Okay, so what are then the benefits of applying for IN-4-AHA's twinnings in this case? So the benefits that we have are for at least 5,000 euros that you receive shared between the two. This is specifically for travel and accommodation, and the funds are reimbursed of the expenses. Also, as you can see on the screen, you'll have an MAFEIP tool for impact assessment, which is free of charge. Sorry, I understand that we have a question in the chat. No, sorry. Okay, so Mr. John Ferrero writes that for any region addressing loneliness issues following the project of deliverables, it might be of interest to share. Okay. Sorry, I have to leave, Ms. Cyan. Okay, we hope that you might apply, Ms. Cyan. Thank you. Okay, so sorry, then continuing with the benefits. Okay, so again, as I said, this will cover for travel and accommodation. We understand that COVID might happen. So if in case of travel restrictions due to COVID, the EU countries during 2022 activities and meetings should be altered from in-person to, in case it should be altered from in-person to remote or digital. When possible, this might be postponed the meeting to a later date, might be facilitated. Where a face-to-face meeting might be an option. It's something that can be discussed and might be good for you to know with these times of uncertainty. Okay, so moving on. So how to apply? So the process to apply is very easy. So both the originator and the adopter can do a joint application within the Google form within this link. This will be, of course, shared later. Alternatively, and probably the easiest way to do it would be to contact my colleague, Claudia Campos, through this email, and we will be able to send you a MS Word, Microsoft Word editable version of the same form, and it will need to be filled out both by the originator and the adopter. So it's ideal that you already know who you want to contact with, and then to decide what is going to be shared, what are the objectives, and to establish the goals from ahead. So this is the end of the, again, this has to be done until the 4th of February. You'll need to present also then a midterm report by the 31st of May, 22, of course, and a final report on the 30th of September with the major achievements and all of that. To allow the IN-4-AHA consortium to then adapt parts of innovative practice in their communication channels and deliverables, and to participate in future IN-4-AHA activities, including but not exclusively the development of its scaling up model. So besides the twinnings, there might be then further help from IN-4-AHA to scale up the technologies that are being shared and what can be done. Okay, so and a wrap-up webinar is planned for July 22, also regarding lessons learned from the twinnings and cross-border scaling up. Okay, so this is the end of the presentation. If anyone has any further questions, either I or Claudia would be very glad to clarify anything. Thank you very much. Let me. Okay. So if there are no further questions, so thank you all very much for showing up to this webinar, this workshop. Sorry, the deadline for applications is until the 4th of February. So it's very soon. So we don't have many days, but if you're interested in participating, please contact Claudia to the email that we're going to write now on the chat. Thank you very much, Claudia. So we have another question. So if you can ask the question, please. Thank you, Ms. Charlila. Sorry for.
Oh, hi. Thank you.
Spelling.
Yes, hi. I'm Hariklia. I just wanted to state in words the obvious that thanks to the idea of twinning by John Farrell, we not only are exchanging ideas, we actually making communities that we actively pursue the adoption at the cultural level of all these wonderful technologies that have been incorporated. It's not just that people go and visit and learn. We are creating communities that can pursue this and increase our knowledge of how best to disseminate technologies in an effective, hands-on way. In other words, a pan-EU living lab. Thank you very much for this wonderful workshop. Thank you.
Thank you very much for your contribution.
Thank you, Sharikli.
Okay. Any further questions? Okay. So in that case, thank you very much all for participating in this twinning. It was very great for me to hear from all of you, and we hope to see all of you very soon within the next webinar, twinning and activity from IN-4-AHA. Thank you again very much, and have a great day. Thank you.
Powering the innovation for active and healthy aging.